may feel a little bit, but you're very good.
I'm gonna go live.
Yeah, you get it going.
You're live.
Hey guys, it's Dr. Emer, and we're finishing up our day at our once a month Saturday clinic. And every so often you get, somebody that comes in that already has beautiful features that just wants a little bit more. They get greedy. So we're taking our patient here today who already has beautiful, luscious lips, and we're going to give him a little bit more flair. And to do that, we're doing what's called a pillar technique. And we're using the filler to kind of pull the lip out. We do little struts. And actually this technique, even though it's very popular right now online, I've been doing this for 10 years. We used to do this because when you go in this direction, you actually avoid the blood vessel that's in the back, and it's actually less likely to do major bruising. So when we first started doing this about 10 years ago, we were doing this much more often, but the look of this was a little bit more robust. So we stopped doing it as much when subtle became popular, but every so often, that's the look that you want. We want to get it to pop. So we're going to use Juvederm Ultra Plus, which has a nice ability to lift and shape.
How long does Ultra Plus last?
I mean, it depends on the person. In most younger men, probably 9 months, 6 to 9 months. And it will look a little bit more, I hate to say clunky, but it'll look a little bit more large at the beginning for the first 2 weeks. Let's move with you guys a little bit. But by going slow and doing these little struts throughout, it's really gonna, you'll see, make his lip turn out and give him a really nice look. Exactly what he's going for. Do a nice massage.
If you touch up the filler every couple of months, will it last longer?
Yes, actually it would. Because each time you do it, the body will hold a little more water. So we really are trying to get a nice lusciousness here. Voluptuousness, which he's going to have now. And it's always going to look a little bit more even now. Good.
How often can you touch up your filler?
As often as you want. Usually I tell people wait about 2 weeks before they do it again because there's swelling. We always want to keep everything really even and you don't want it to clump up. But now we've got that nice enlargement there. Let's go to the upper. We're going to do again these little baby struts. Using this pillar technique allows us to get a nice elevation of the tissue. An overall kind of voluptuous look. Nice definition along the border.
What does it feel like?
Sir?
It actually doesn't hurt. It just feels like a little pinprick.
So it's not too bad. He's very strong. He also knows beauty and pain, they go together. So he's mentally prepared. But lip fillers do hurt a little bit. We have really strong numbing cream. Personally, I don't like to use nerve blocks for the lip, which a lot of places do, because I think it changes actually the shape of the lip a little bit. Take a look at the front real quick, you guys, a sec. Just a quick look. Ooh, those are beautiful.
Right?
Those are nice.
I'm like, wow.
Here's the thing, with every patient's face, sometimes, it depends. Subtle isn't always what somebody wants, and you can get them a little bit more. For example, when Kylie went really big with her lips, it worked for her. But even when she's less in her lips, it works for her. So sometimes you can push the limit a little bit. What I want to do is give a little bit of lift to the upper cupid bow. I think he's going to be very happy. Now, for those of people watching who know a lot about fillers, you're going to notice his lips are turning a little white. And the reason that is I add epinephrine to my filler because it stops the bruising. We don't want him to be too bruised tomorrow, even though we're doing all these needle pokes. So I know a lot of people get nervous that that could be vascular occlusion or a problem with the filler. But we do this a lot. I've done this for years. Everything's gonna be fine. Just because he has the epinephrine in there, within a few hours that will go away and he'll look great and he'll have less bruising. So let's show him. Hold on. And just do a little massage. Make sure everything's nice and even. He's gonna love it. Again, we just always make sure it's very even and smooth, which it is. All right, let's show him how it looks. Hold on. Okay.
Oh, they're perfect.
What did you say?
They're perfect.
Yeah, those are going to be... What did you want? Tell everybody what you wanted.
I wanted a bigger pout and just luscious lips.
And here's the thing, though. If you turn from the side on him, look, it does not look like they're protruding. It fits his face, so he can do this. They're bigger, but they work. I think they look great. And the other thing, too, is even though we elevated the border, and you can see in that angle it looks really good. Look this way a little bit. That angle, you can see we lifted the border, but it doesn't look like it's protruding forward. So this is voluptuous, luscious, plumped, beautiful lips, and that's Juvederm and somebody that